Bienvenidos y bienvenidas al lanzamiento de una nueva.
Welcome to the launching of a new agenda for mental health in the Americas, a report of the High-Level Commission on Mental Health of the Pan American Health Organization. I am Renato Oliveira, head of the Mental Health Unit of PAHO. It is a pleasure for me to be here to moderate today's event. Without any further ado, I would like to introduce the director of the Pan American Health Organization, Dr. Jarbas Barbosa, who has some opening remarks. Thank you. Thank you, Renato, and good day to one and all. First of all, I would like to recognize and thank the members of the Commission, including its chair, Her Excellency Epsi Campbell-Barr, and all of the members of the Commission with us here today, and others who are joining us via Zoom. I would also like to thank the ambassadors who have joined us, as well as our colleagues from the OAS who are also with us today, and our colleagues from PAHO as well, and our former director, Dr. Etienne, who initiated very interesting activities, including the establishment of this commission. Thank you for being with us. A very warm welcome to everyone with us today. It is significant to have so many with us with this new agenda for mental health for the Americas. The report of the High-Level Commission from the Pan American Health Organization. I would especially like to thank Dr. Epsi Campbell-Barr, former Vice President of Costa Rica and Chair of the PAHO High-Level Commission on Mental Health and COVID-19. I would also like to thank Ambassador Nistor Mendez, Assistant Secretary General of the Organization of American States, co-chair of the PAHO High-Level Commission, as well as the other members of the Commission, Dr. Ruben Alvarez, Dr. Mary Bastra, Dr. Bolton, Professor Pamela Collins, and Professor Paulina del Rio, Ambassador Jimenez, Dr. Shirley Holway, and Dr. Katy Kajan, and Dr. Maria Elena Maria Mora, and Dr. Ana Cristina Mendoza, Professor Poli Rossi Navis, Alejandra Mora Mora, Professor Shoka Karina, Dr. Paula Libe, and Dr. Vasquez for their important contributions to the work of the High-Level Commission on Mental Health and their contributions to this report. I also wish to recognize Dr. Frank Anthony of Guyana, also Delia de Icaza, National Head of the Mental Health Section of Panama, for participation today, as well as Deborah Ketzel of the Department of Mental Health and Substance Abuse of the World Health Organization. And she is here at home as well, who has joined us today to celebrate this important achievement for our region. During the last 3 years, the COVID-19 pandemic has had a negative effect on our region, with an enormous loss of lives, social transformation, and significant economic losses and health problems without precedent, which go beyond physical disease and death related to the virus, including an increase in mental health conditions with an unsatisfied demand for services. As a response to this mental health crisis, PAHO set up the High-Level Commission in 2022 in order to provide guidance and recommendations in order to improve mental health within the context of the COVID pandemic and beyond. Today, we conclude the launching of the report, and this marks the closing of an intense year of work with many in-person and virtual meetings and with many collaborating on critical areas, with many consultations with the stakeholders. We would like to express our enormous gratitude for your contributions and for having given your experience and your time so generously. I will now switch to English.
Agenda for mental health in the Americas into concrete actions to effect the changes necessary for the prioritization of mental health in our health systems. The COVID-19 pandemic presents an unparalleled opportunity to not only rebuild our mental health system and services, which were severely tested by the pandemic, but also to build them back stronger than before. This report serves as a critical roadmap to guide us towards the vision of achieving well-resourced, equitable, resilient, and sustainable mental health systems and services able to manage future emergencies. I call upon all countries in the region, irrespective of their progress in advancing their mental health agendas, to take note of the recommendations of the High-Level Commission on Mental Health and COVID-19, and to take immediate action to ensure that these recommendations are integrated into national and intersectoral mechanisms, allowing for comprehensive and coordinated approaches, leading to optimal mental health outcomes for all. I also encourage the widest possible dissemination of the report throughout the Americas to ensure its recommendations are part of our ongoing efforts to drive meaningful change in mental health. Together, let us embrace this opportunity and join forces to realize our shared vision of mental health for all throughout the Americas. Thank you.
Muchas gracias, Dr.
Thank you very much, Dr. Barbosa. And now we have a welcoming video from Gabriel Boric, President of the Republic of Chile.
Ustedes hoy día en el lanzamiento del informe sobre salud mental del comisionado de alto nivel y también respecto a los efectos del COVID-19, pero les quiero recalcar la importancia que para nuestro gobierno tiene la salud mental a la hora de elaborar políticas.
I emphasize the importance of public health in our country. I think we need to talk about mental health more openly. For many years, this has been contributing to the isolation and the stigmatization of those who have problems in regard to mental health. So this is why we have especially focused on children and adolescents. And we've also made the greatest investment in 30 years. We know that there's an enormous gap, a budgetary gap, in regard to the budget for mental health in Chile, and we need to increase the budget here. Now, we have information. We see that 1 out of 4 in our country suffer some condition of mental health, and they don't have access to treatment as periodically as it is necessary. We also want to improve policies in terms of public health, and especially when we talk about the stress which we saw during the pandemic, and how we also saw a tool of a digital hospital, and we also have a new telephone line for suicide prevention, which we see with great concern, especially in the youth sector, where this has increased. Now, one of the goals we have is to set up more community centers. And certainly as a government, we are committed to this. We want to make sure that the stigmas are broken down and that we look at the report of the High Commission in detail on these very relevant areas in Chile and the world today. Warm greetings. We would especially like to thank His Excellency President Boric for assisting us in the launching of this work and noting the important work being done by Chile in mental health. Now I would like to introduce Mr. Nistor Mendez, who is Assistant Director of the OAS and also co-chair of the Special Commission, for his opening remarks. Ambassador Mendez.
Barbosa, Director of the Pan American Health Organization, Dr. Epsi Campbell-Barr, former Vice President of Costa Rica, Chair of the PAHO High-Level Commission on Mental Health and COVID-19, and dear friend, esteemed members of the High-Level Commission, ministers and health authorities who are joining us remotely. I'm very happy to see so many of our permanent representatives and alternate representatives of the OAS joining us this morning. Special guests, special hello to Dr. Carissa Etienne, who's joining us this morning as well, the PAHO technical team who has worked tirelessly on this endeavor. Ladies and gentlemen, good morning. I would like to express my heartfelt gratitude to our PAHO director, Dr. Jarbas Barbosa, for his relentless dedication and commitment, to the chair of the commission, Epsi Campbell-Barr, for her exemplary leadership, to our esteemed commissioners for their invaluable contributions, and all high-level participants, special guests, and the public. Your presence today affirms our collective commitment to addressing the pressing mental health crisis. Special thank you also to Dr. Carissa Etienne, Director Emeritus, who was the one who called upon us and invited us to form the commission. Before proceeding, let me mention that Vice President Campbell-Barr, whose leadership and wisdom have been instrumental to the Commission's work, will soon take the word to explain the report's details. Her insights will provide a comprehensive understanding of the depth and breadth of our findings and point out the path towards implementing the recommendations. Establishing this commission was not a matter of choice, but a necessity. As we all know, our region has been struggling with gaps in mental health even before the COVID-19 pandemic. The pandemic has only exacerbated these gaps, thrusting mental health into a more significant crisis mode. We have all witnessed how COVID-19 has magnified social, economic, and health inequalities, and disproportionately impacted millions of people's mental health in the Americas. Serving as co-chair of this commission, I have come to recognize the enormity of the problem. I have been privy to stories of despair, of anxiety and grief, but also of resilience and hope. I have learned that if we fail to act on mental health, we stand to lose the gains in other health and social development aspects. This commission has thus been a beacon of hope, a promise of action, and a testament to our unwavering commitment. The report we launched this morning is no ordinary document. It is innovative because it synthesizes and amplifies the lived experiences of people and presents practical and implementable solutions. The recommendations therein are based on equity, justice, and solidarity principles. It focuses on integrated, community-based mental health services and underscores the importance of addressing social determinants of mental health. We have strived to bring the voices of the unheard and the marginalized to the forefront and turn mental health from a silent crisis into a public priority. My vision for this report is ambitious but achievable. I foresee this report as a catalyst for a significant shift in how we view and address mental health. It has the potential to bridge the gaps and build resilient health systems that can effectively respond not only to the COVID-19 pandemic, but to future health crises. Our work as a commission has paved the way, but it is up to all of us to ensure that the report's recommendations translate into tangible actions that positively impact the lives of our people. Moreover, this commission can serve as a model, demonstrating how collaboration, commitment, and shared vision can lead to transformative actions. We have been guided by the principle that health, and in particular mental health, is understood as a human right and should be accessible to all, regardless of their socio-economic status. We must carry this principle forward in all our efforts and ensure that no one is left behind. As the co-chair, and on behalf of the Organization of American States, I reiterate our unwavering commitment to supporting the dissemination and implementation of the report's recommendations. We will work closely with PAHO, with our member states, and with our partners in civil society to ensure that the recommendations made in this report are incorporated into national mental health plans, policies, and legislation. We will foster dialogue, promote collaboration, and find the necessary resources to ensure mental health receives the attention that it deserves. Let me finish by expressing my deepest gratitude to everyone involved in preparing this report. This has been a journey of solidarity, of resilience, and hope. Let us remember that while the challenges we face are enormous, our collective strength and determination are even greater. The launch of this report is not the end, but the beginning of our collective commitment to improving mental health in our region. Together, we can and we will make a difference. Thank you.
Muchas gracias, Embajador Mendez.
Thank you, Ambassador Mendez, and our most sincere thanks for your work in the Commission. Now we're going to show a brief video that depicts the Commission's work.
The region of the Americas include devastated economies in the region, unemployment, poverty, inequality, and many more. Mental health conditions have surged, while mental health services have struggled to meet the new, increased, and urgent demand. The Pan American Health Organization convened the High-Level Commission on Mental Health and COVID-19 to help policy and decision-makers by providing clear guidance on how to best advance mental health during and after the pandemic. The Commission includes 17 members representing governments, health organizations, academia, civil society, and people with lived experience from across the region. It is led by Her Excellency Epsi Campbell-Barr, former Vice President of Costa Rica, and Ambassador Nistor Mendez, Assistant Secretary General of the Organization of American States. The commissioners worked throughout 1 year, consulting with experts, directors of mental health programs, and representatives of civil society organizations. The result? A new agenda for mental health in the Americas. Focused on actions in the immediate term, this new agenda aligns with current global and regional mental health and development objectives, including the WHO Comprehensive Mental Health Action Plan 2013 to 2030, the PAHO Policy for Improving Mental Health, and the 2030 Agenda for Sustainable Development. The NAMHA outlines 10 recommendations with corresponding action points, accompanied by case examples from the Americas which highlight successful models to guide implementation. It presents evidence-based approaches to address the crisis generated by the COVID-19 pandemic in the short term, while laying robust foundations for the longer term, to ensure optimal improvements in mental health care in the region of the Americas. The effects of the COVID-19 pandemic.
Ahora tengo el honor de presentar
Now it is an honor to present Her Excellency Epsi Cambobar, former Vice President of Costa Rica, and also the Chair of the Commission, who will discuss the final report of the Commission. Thank you, Renato. I first of all want to extend greetings to Dr. Barbosa, Director of the Pan American Health Organization, from my colleague, Ambassador Nistor Mendez, co-chair of the Commission, as well as to the delegates from the Commission members, in addition to the members and authorities that are with us, as well as our special guests and all of you who are part of this very important event. I would like to begin by expressing my appreciation to Dr. Etienne. With Dr. Etienne, we held many discussions previously, and then later we consolidated extraordinary experiences working at the Commission on mental health and COVID-19. Thank you very much, Dr. Etienne, for opening the door of the open organization. I also want to thank Renato, as well as Dr. Renato Oliveira, Dr. Henning, for offering the possibility of working with the entire PAHO team. We've had a marvelous experience. Dr. Jarbas, I would also like to congratulate you and also congratulate all of those who are a part of the process, all of us, because under your management, this issue has become a priority. I'm referring to mental health. And this is what we call, in this case, that's what we're really emphasizing in this report. It is an honor for me as the chair of the COVID-19 and Mental Health High-Level Commission. This is a new hope for mental health in the Americas. Before we get into the details, allow me to just recognize those fundamental key players in the report. The Commission is composed of 17 representatives from throughout the Americas who represent governments, healthcare organizations, the academic sector, civil society, and people with their own, who bring their own professional experiences. Each one of the members have undertaken a critical role in formulating and creating NASMA, and we want to express our recognition and appreciation. I would also like to express my appreciation for the commitment and the contributions by our dear co-chair, Ambassador Nistor Mendez, as well as the commissioners, Ruben Alvarado Munoz, Mario Bantran, Paul Bolton, Pamela Collins, Paulina del Rio, Carmen Jimenez, Shirley Alloway, Maria Elena Medina Mora, Ana Cristina Mendoza, Paulo Rossi, Menenes, Alejandra Mora Mora, Shekar Sajena, Juan Pablo Uribe, Sahar Vasquez, each one of them who have made possible this event. They played a crucial role in building this agenda. They've provided their unique and very valuable perspectives. I also want to pay special attention to some of the details that we see in the here in the screen, where you see a detailed schedule of all the meetings that took place in the preparation of this report. So it's been through various working group sessions and discussions, debates. Each one of these meetings played also a key role, a comprehensive role, in creating this new mental health strategy. Transparency, inclusiveness were fundamental pillars that made up this effort. And this chronology provides a complete vision of this collaborative effort, and a constant one that is necessary in order to achieve these significant landmarks and the path towards improving mental health in our region. We also propose a new agenda that address the current and future challenges in both mental health in the region, where we take into account the COVID-19 pandemic impacts. So the program that we present is specifically a set of priority measures in the area of mental health that have been designed to become incorporated into post-pandemic recovery strategies in our countries. And this is based on the principles of universal health care coverage, human rights, equity, non-discrimination, and empowering people who are suffering from mental health issues as well as their families. So this is based on a collaborative approach as well as a community-based approach, with the understanding that mental health should become a priority for the dignity and well-being of all members in our society. So the report is aimed at promoting the social and development agendas of the high-level authorities in the Americas. And I said high level, not only, though, am I referring to the health authorities. Its usefulness transcends sectoral boundaries and serves as a tool for those who are responsible for formulating healthcare policies in education as well, in the economic realm, social welfare, development, justice, labor, employment at the national level and at the local level. But it also involves the private sector, academia, as well as civil society organizations, in addition to community organizations. So our report provides a framework that is evidence-based, as well as based on experiences that can be adapted to local scenarios, and at the same time is highly useful for addressing challenges and barriers. So this contextual approach has enabled all countries, regardless of their resource limitations, to implement an agenda aimed at improving the mental health of their communities. So we understand that although we need to increase investments in mental health measures, we can start off by doing things from the step one if we take as a reference this report. So we present in this report 10 recommendations that are accompanied by examples from the case studies in the region of the Americas that provide effective models that will help guide in the implementation process. These recommendations cover areas that are considered urgent for our region, and they offer short-term strategies in order to address the crisis generated as a result of the COVID-19 pandemic. And at the same time, sound long-term bases have been established in order to achieve improvements in optimal conditions in increasing mental health care services. We know that mental health has become an issue that really has an impact on the entire society, and they need to be addressed from a preventive perspective. But it also needs to address specific actions for those persons and sectors that require special care and attention. Let me just briefly explain each one of these recommendations. The first recommendation suggests, first of all, to raise the profile and significance of mental health at the national and supranational level, establishing this as a priority for its development and seeking its inclusion into the universal healthcare coverage framework, instead of seeing it as an exception for those that require services. We need to view it as a fundamental requirement in order to achieve a universal healthcare coverage that is quality healthcare for our citizens. And this is really our most ambitious objective. In other words, take mental health out of the ghetto and make it into a priority as far as health for all citizens is concerned, and that it needs to become incorporated into the plans, services, as well as a part of the universal health care coverage framework. The second recommendation is one that advocates for integrating mental health in every policy area as well as sectors, including disaster and emergency responses, everything related to climate change, experiences that we've had with the pandemic itself. All of this is incorporated and proposed in recommendation 2 because we fully understand, according to analyses that were undertaken with the Commission, now we know what are those impacts related, for example, with the COVID-19 pandemic, and how it fits into the context of general health provisions, and in addition to, because of the new conditions that COVID-19 imposed on us, this has to be seen in that context. And this is fundamental because we understand that emergency response needs to include a mental health component and perspective, not just including traditional services. It needs to include mental health services and crises that we see throughout the region. For example, the migrations, the migrants living in camps, those that have been victims of emergencies relating to climate change. All of these need to also include mental health services. Our third recommendation suggests or proposes an increase in funding for mental health to make it an allocation that is more efficient and more equitable in terms of providing resources. Now, this recommendation, let me just first state that during this time, we analyzed the impacts in the realm of mental health for those that are providing health, and the impact that they had during the impact, the day-to-day impact that these mental health workers or healthcare workers are providing, and it needs to be a part of a general strategy. The fourth recommendation is one that promotes and defends the human rights of people suffering from mental health challenges, seeking to reinforce this through new legislation and policies that will in turn provide or promote a transition to healthcare institutions that are more community-focused. Based on our analyses from experiences, that it's necessary to transition gradually those models that have been established over the last few years. Based on our experiences, we need to carry out that transition that is a joint effort among the various institutions that are addressing mental health issues, as well as working with the communities where people who are then brought in after they've been hospitalized. The fifth recommendation highlights the importance and the need to promote and protect mental health throughout a person's life cycle, emphasizing preventive strategies as well as safe environments in every phase of a person's life. We need to look at, for example, issues involving young people and problems that these groups face and that as a result of the pandemic might also suffer. But it also includes addressing the needs of the elderly and provide that entire life cycle support. The sixth recommendation refers to measures aimed at improving and expanding healthcare services that includes at the community level, that includes integrating mental health at the primary health level, as well as the use of digital services and empowering users as well as their families. The seventh recommendation proposes a specific guidance based on evidence-based strategies in order to prevent suicide as well as risk factors. And this is done through the formulation of national prevention strategies as well as the promotion of public policies regarding the reduction of means of suicide as well as alcohol consumption. The eighth recommendation, where I want to place special emphasis, proposes a transformational change in the way that gender issues and mental health are addressed. This proposes measures aimed at reducing gender inequalities as well as confronting gender-based violence, as well as the hegemonic masculine approaches that constitute a major effort in terms of mental health. One of the factors that affect the mental health of women, and even men in some cases, because here we're looking at ways of combating these hegemonic masculine perspectives that place people in a state of vulnerability and creates stress, powerlessness, and anxiety. As a result, these realities of gender inequality and violence, family violence. The 9th recommendation highlights the importance of addressing racism and racial discrimination as a key determinant in mental health. And this is fundamental because we understand how systemic racism, how the cross-generational health also needs to be addressed with technical measures, needs to be addressed with specific recommendations. And that's why we emphasize the need to combat systemic racism through cooperation and coordinating measures with those communities affected, as well as creating and developing national plans and reinforcing existing legislation and measures and standards to promote anti-racist environments. And finally, the 10th recommendation urges an improvement in research as well as data collection in the area of mental health. We promote measures in order to improve the compilation of data as well as the sorting and follow-up and evaluation of data, in addition to promoting research in these priority mental health areas. So I'd just like to finish by thanking the Pan American Health Organization for giving us the opportunity and for me the pleasure of having chaired this high-level commission. The honor for me and for those of us who have been involved to present this report 1 year later with specific recommendations cannot be underestimated. We'd like to thank all of the colleagues that were participating in this effort. This was an environment of cooperation, a spirit of collaboration that allowed us to prepare this report and submit it today. It reflected a commitment to follow the entire process. Dr. Yarvas, you as the person responsible, well, the director of the PAHO, I congratulate you as we implement these recommendations, and thank you very much. Thank you very much, Epsi Campiobar. We know the significant effort that was devoted in preparing this report and its significance for the region. And now I'm going to switch to English.
That the authorities here in this table take their seats in the audience, and we'll take just a few minutes to set up for our next panel. I'd like to invite our esteemed panelists to join us at the table. to some of the key priority issues from the report's recommendations. To moderate the panel, I introduce Ms. Deborah Castell, Director of the Department of Mental Health and Substance Use at the World Health Organization. Ms. Castell, the floor is yours.
Thank you, Renato. Gracias. Voy a hablar en español.
I'm going to speak in Spanish, thank you. And I'd like to thank Director Jarbas Barbosa and the entire PAHO team for the privilege to be here with you this morning. I don't think it's necessary to explain the reasons why mental health is so important coming out of the pandemic. I think we understand that pretty well, and that's why we're here today. Because we know and we recognize the significance of this. In fact, I would add that now we need to determine and see exactly how we're going to use the opportunity that we have before us, now that we have this global attention that is being paid to mental health. How can we use this in order to increase the pace of mental health reforms that are way overdue and should have been advancing for some time? There are countries in the region that have made progress and that have shown the way that other countries need to follow and that need to use as an example. So these reforms that we hope to see in the realm, in the field of mental health, is key, and it needs to be seen from a broad perspective. On the one hand, mental health and well-being is by itself a key issue, but we also need to look at some of the major challenges stemming from these measures that need to be addressed. There's a trend or tendency sometimes to minimize the impact of mental health, especially when we're looking, well, its focus is mainly on promoting well-being. And this has historically been a pattern where we've left to one side the most complex challenges. This really requires, therefore, a greater interaction that goes beyond the healthcare sector, as the Commission members have already clearly expressed. So from my perspective and from my role, the significance of the Commission and the recommendations is basically focused on showing the way that we need to follow in order to make sure that we transition from slogans and a lot of lip service. We need to transition into measures that will really create this new priority, will implement this priority where mental health is for everyone. So we have identified a priority issue in the agenda of the PAHO and also in the respective governments. The effort of this commission and the report that we just submitted with very specific recommendations is what is expected of member states in order to advance their public health agenda. This is highly relevant so that we can see exactly what the progress is that has been made, and hopefully we can replicate these experiences to other regions. I personally speaking, I'm very interested in learning more from the reforms implemented. How do we measure the impact of these changes that are so necessary and that have been making progress for some years in the region? And how do we view what needs to be done, and how can we improve with regards to these changes in the region? And also, I would also like to learn more over the next few years about the role of social determinants that we had seen earlier. How do these issues impact us, and how are they impacted in turn? How is mental health affecting this, and how it is in turn impacted? And what are some of the changes that are necessary in order to have a greater impact in mental health?
I hope then that this panel will provide some responses. So in any case, we have very little time. So I will stop here, and now I give the floor to the next speaker. It's difficult for me, but in any event, now the topic here of this panel is a new agenda for mental health, main priorities. And we have representatives of the Pan American Health Organization as well as members of the Commission. I will introduce them one by one. And first of all, we have Dr. Nistor Mendez.
Dr. Nistor Mendez is Director of the Department of Non-Communicable Diseases and Mental Health of the Pan American Health Organization. And my question to you then is, what is the importance of the Commission's recommendations for the region? How can countries and other actors that need to take a role in this process will use, you hope, will use the report to improve and to advance mental health in the respective contexts? Over to you, and you have 4 minutes only.
Thank you, sir. Thank you so much, Deborah Kestel. Now, the Commission's recommendations are a major contribution to the debate on how the region of the Americas will recover progress in mental health that has been severely disrupted or lost as a result of the COVID-19 pandemic. We all know the problems. The nearly 3 million lives lost, the highest of the 6 WHO regions, the increased rates of mental health conditions, the worsening disparities, the social isolation, and those lost years of childhood and adolescence. The recommendations of the report are very much based on evidence-informed approaches for countries to address the mental health needs of their populations. Ultimately, the ambition is to advance the overdue transformation in mental health care throughout our region. The recommendations highlight the urgent need to prioritize mental health by elevating it to the highest levels of government and ensuring its integration into all policies and sectors. This report also emphasizes the critical importance of positioning human rights and equity at the center of the transformation in mental health. As we are aware, there are significant disparities in the Americas within and between countries. The Commission has recognized the social determinants of mental health, such as systemic racism, harmful gender norms, and stigma and discrimination, and has developed clear recommendations to address these major causes of inequity. I believe that this is one of the highly innovative outcomes of this report. This report also encourages multisectoral collaboration, urging countries to engage stakeholders from not only the health sector, but highlights the importance of building strong partnerships with other sectors, including education, social welfare, and of course, civil society, as well as the private sector, to collectively address mental health challenges. The Commission's recommendations speak to the need for countries to strengthen their mental health response systems, ensuring better access to quality mental health services for their populations. This, of course, includes a life course approach and the integration of mental health into primary health care and community settings. PAHO has been working assiduously to promote community-based care for mental health rather than sustaining the model of mental health institutions, and I'm pleased that this has been supported by the Commission. The Commission has also emphasized the importance of investing in mental health. This includes both human and financial resources to ensure sustainable and effective mental health services and to address the chronic mental health gap. The recommendations of this report can serve as an important tool to promote equity, reduce disparities, and build well-sourced and resilient mental health systems that not only provide the services that we need, but are also resilient enough to withstand and respond to future emergencies. Thank you.
Thank you. Thank you very much. And it is definitely a big agenda to move forward that you will have to follow and make sure that the action is at the country level where it should be. So we move to the next one, and that is Dr. Jaime Bayona Garcia. He's a senior health specialist of the World Bank Group. On behalf of Dr. Juan Pablo Uribe, who is the Global Director of Health, Nutrition and Population and the Global Financing Facility of the World Bank Group. And the question to you, Jaime, thank you for being here, is about, of course, financing. The report urges countries, and it was just reminded to us by Dr. Hennis, urges countries to improve both the quantity and the quality of the financing for mental health. So how much, in your experience, in your opinion, should countries invest in mental health and what should they fund, and how countries with limited resources could nevertheless improve that situation.
Muchas gracias.
Thank you very much, Dr. Kestel, for the question. It is very clear that mental health financing is inadequate currently. The countries of the Americas assign an average of 3% of its total budget for health to mental health. And this certainly needs to be increased. There is no precise figure that we could assign to all of the countries or that we could estimate. This depends on the context and the local needs. Nonetheless, we know that the Lancet Commission on Global Mental Health and Sustainable Development has recommended that a minimum of 5% of the health budget for countries of low and medium income be the amount allocated, and 10% of the budget in countries of high income, so that these funds be available for mental health. In addition, we must bear in mind that quality financing needs to focus on mental health, and this needs to be evidence-based, which is effective. What is happening today is that at the hospitals, at the psychiatric hospitals, they are receiving 43% of that 3% that is being allocated to mental health, and they are not necessarily providing services in the quantity and quality expected. And because of this, we see that if these health services are provided at the community level, we could have improved results. The countries must invest in community care, and this includes integrated mental health services at the primary care level and at general hospitals, with support for community care and social care. This would provide us with a much better scenario in order to deal with the social determinants that affect mental health problems. Now, to round out this idea, we must continue to generate evidence, and this is a commitment from all of us. It is understood that all of the countries at this time have problems in order to satisfy various health needs, and this has become even more complex after COVID-19. Nonetheless, we must continue to encourage the countries for them to seek new and diverse sources of financing, and we need to provide more opportunities for being able to gather national funds. And thus, we will have mental health being financed from other areas, receiving financing for activities in health. Now, it may be that in terms of short-term investment, this may be too much from the perspective of the ministers of finance, but we must understand that the long-term reward is there. And when we look at return on investment in countries such as Jamaica and Peru, they have already demonstrated that there are high economic and social yields, especially when anxiety, depression, and psychosis are treated. And we hope to continue documenting this in the region. And with that, I close. Thank you very much, Jaime. This is an incredible panel. I know I'm controlling the time, and the comments have been excellent. So we continue to collaborate with the bank, with the World Bank, for the generation of further investment and how we see health as an investment.
Who is the director of the University of Washington Consortium for Global Mental Health, University of Washington here in the US. And Pamela, the recommendations emphasize the importance of addressing social determinants, special emphasis on gender and race that have been, we heard about also in the previous comments. And so how do you, what can you tell you, how do gender and race impact mental health in the region of the Americas, and what can we do, what can be done, and we all do, to reduce mental health disparities and inequalities in accessing mental health based on these two factors?
Great. Thank you so much for the question. And I want to start by reminding us what social determinants are. These are the factors that influence the social and economic circumstances of our lives, and that therefore influence our health and our mental health and well-being. So these are the situations into which we are born, live, work, age, and they influence the resources that we can access, including healthcare. So these circumstances, or social determinants, drive many persistent health inequalities around the world. And these can include lower life expectancy, greater burden of disease, including mental health conditions, particularly among disadvantaged populations. And I want to take a moment to clarify that health inequities are those health inequalities that are systematic, that are socially produced, and therefore modifiable and unfair. So this report focuses on how do we modify those inequalities that disproportionately affect people due to gender, due to race, and due to other social disadvantages. So the Commission, as was mentioned, chose to focus on gender and race in its recommendations because of their impact on mental health. We know that gender norms, values, and discrimination can expose people to mental health risks and affect their ability to seek health, affect their access to services, and their outcomes. And as we heard a little bit earlier, the Commission's recommendations really give some guidance to how one can reduce these harms by promoting women's empowerment in particular. Women in the region are underpaid, they're underrepresented in decision-making positions, by strengthening gender-based violence prevention and response, by addressing some of the harmful effects of masculinities on mental health. So here, I think an emphasis on a life course approach is very important as well, as Dr. Hennis mentioned. Gender norms are often consolidated in adolescence. They tend to reinforce girls' unequal positions in relationships. Girls also experience a much higher incidence of depression among adolescents. And as we think about how to, as the Commission moves forward and as countries think about how to implement these, remembering to take a life course approach will be incredibly important. And quickly, I want to mention systemic racism and discrimination, of course, as critical issues in the area. And there are three pathways that link racism to these inequalities: cultural racism, embedding of inferiority of different groups into belief systems. Second pathway is through institutional or structural racism that refers to the societal structures and policies that reduce access to goods. And the third is individual discrimination. So the Commission's recommendations focus on addressing racism and discrimination so that governments can actively combat this. So we propose through the Commission to work with groups specifically that are experiencing racism and discrimination, to develop action plans against racism and discrimination, to strengthen legislation to combat these, and to implement multi-level interventions to address these issues. So just to close, these adverse experiences across the lifespan, like stigma and all of its forms of prejudice, discrimination, gender discrimination and violence, poverty and income inequality, these kinds of social determinants affect all health outcomes, including mental health outcomes. And I think what's important about the Commission is that while we recognize the importance of data and research that can inform our path forward, it also emphasizes that we as advocates and professionals and communities have an ethical responsibility to actually confront the social processes that fuel these problems. And it's these recommendations that outline some of the places to begin. Thank you.
Thank you, Pamela. Thank you very much. And definitely the fact that there are concrete examples in the report for countries to follow should help moving the agenda forward. Thank you very much. Let's move on now to Dr. Khatija Khan. She's the president of the Caribbean Alliance of National Psychological Association in Trinidad and Tobago. And the question for you, Khatija, is on about the treatment gap in the region of the Americas. As in every other region, the treatment gap for people with mental health conditions is very, very high, arriving up to 90% of gap in terms of who has access to care, to mental health care. So what is that the Commission recommends, how the Commission recommends increasing the accessibility and the coverage of mental health care and services? Over to you, Khatija.
Thank you for the question. Now, improving mental health and wellness in our populations is contingent on services being available and accessible by those who need it, and the treatment gap is a big barrier to this. We've heard from many of our speakers today that one of the Commission's core recommendations aims to improve and expand community-based mental health care and services. And it's really important to note that mental health care delivered in communities in which people live and where they can access it, it becomes less stigmatizing, and this will increase accessibility and also increase coverage. Now, the Commission's recommendations are not exhaustive, but they do focus on 5 key actions which can improve the quality of mental health services and care and scale up care to reach more people. So here are those 5. So the first one is to strengthen the integration of mental health into primary health care. We know that there's a shortage of mental health specialists in the region, and so training up primary care professionals to detect, to manage, to follow up treatment in the communities and refer more complex cases is going to help expand care. And we already have resources that are available to help countries do this and build capacity, like MHGAP, for example. The second key action is to build culturally competent mental health services. The diversity in our region, the diversity of our peoples is one of our most valuable resources. But when we have cultural barriers to care, when we have stigma and discrimination, it discourages help seeking and it reduces the effectiveness of care. So it's very critical that we tailor our mental health services to be ecologically valid and culturally competent. The third action is to harness the potential of digital technology. We've all had to become more tech savvy because of the pandemic. So this pandemic catalyzed the use of digital technology for health, such as telemental health. And we have to continue to improve and expand on these remote interventions and ensure that access is equitable and that the capacity is built to deliver and utilize these services. The fourth action is to enhance capacity to deliver mental health and psychosocial services in emergencies. And emergencies are becoming more frequent and intense in the Americas. Many of our countries are dealing with this just this week. And especially those due to climate change, which is associated with many negative mental health outcomes. Many of our countries in the Americas are also small island developing states, which are even more vulnerable to the impacts of climate change. So strengthening mental health and psychosocial support for everyone in emergency contexts is very crucial. And finally, we need to continue to empower service users and their families. People who live with mental health conditions and their families, historically, they've been excluded and discriminated against and not included in decisions on mental health care. Traditionally, professionals have made decisions for them, albeit in their best interests. But we know that when we empower people, when we increase their agency, when we actively allow them to participate in designing and implementing and evaluating mental health services and care, that this improves the quality and effectiveness in addition to promoting a human rights approach. So thank you for allowing me to share those 5 actions.
Thank you. Thank you very much, Khatija. And again, good concrete examples and suggestions are in the report for countries to use. So we move now to our last panelist, and as we say in English, last but not least. Voy a cambiar al español.
Now I will switch to Spanish. We have Ms. Paulina del Rio, president and co-founder of the José Ignacio Foundation in Chile. The Commission has decided to focus on the prevention of suicide as a specific recommendation and emphasis, and I would like to ask you why this is the case. What are some of the actions the countries can undertake to prevent suicide? Well, thank you very much, Deborah. And thank you, Dr. Etienne. Thank you very much, Dr. Barbosa, and all of you who have so successfully headed this commission. And I also wish to thank all of the authorities, those who are with us here and those who are following us on Zoom. Now, I am pleased to see that the Commission has included suicide as a separate recommendation, because the increase in suicide rates in the Americas in the last 20 years has reached levels which in some countries of the region are figures which are among the highest in the world. So to this we add the impact of the pandemic, which has increased risk factors, even the isolation periods. All of this led to the resurgence of many mental health problems. And this new agenda contains a specific recommendation on suicide, indicating the severity of the problem and that this needs to be a priority. I have experienced the suicide of my eldest son when he was 20. And I became involved with civil society. So I believe in this panel. And I am a witness to the fact that we must all participate in suicide prevention. It is something so complex, so multi-causal. We need to approach it from different sectors. It is not something that we can look at from a single perspective, such as health. We need education, labor, welfare, agriculture, justice, law, media, which is so powerful today. And we can also include actors such as NGOs, academia, civil society, and those who have had personal experiences. In the 15 years that I have been supporting others who, like I, have thought of suicide or have attempted it or have a loved one who has committed suicide, or they've seen the death of someone who died because of suicide, have suffered isolation, guilt, and solitude. And we suffer this. This reminds me of a specific example. When I began my morning, there were many who crossed the street to not meet up with me, and many survivors have had a similar experience. It's not because of ill will, but rather because they were afraid that suicide was contagious, or maybe it was simply because they didn't know what to say. And this manifests a certain ignorance and our responsibility to educate. So we see stigma and discrimination. And what this means is that we need evidence-based interventions. We need to implement policies that bring us to a true reduction of the suicide risk, which today have not been very successful in many countries and in my country, which has given a little more of the budget to mental health. And the government of the city of Santiago has implemented a program with the participation of 7 foundations for the prevention of suicide from all the different focuses. This is a 2-year pilot project, and I'm publicizing it because it's a good example for everyone. We must reduce lethal means such as alcohol abuse and other substances. And we need to include these interventions in our national strategies for suicide prevention. And if they are not included, we hope that they soon will be. We always make sure that we supervise in an appropriate manner. And for the end, I will emphasize the importance of an early detection of those who are at risk for suicide. And there are organizations in civil society who have an experience and can play an important role. Because we must give these persons support. They need follow-up. And this is why I'm deeply affected. And I would like to emphasize that this is a task that can be shared by many, and it doesn't require specialized health workers, or it doesn't require primary health care, but it involves the members of the community. And we all know that there is evidence about this. And I have knowledge of the effect of the trauma we suffer to a greater or lesser degree, but we need to confront suicide with all its elements from different perspectives. I also understand the healing effect of an empathic ear, of a hug, of a friendly word. So this is why I emphasize that we must all contribute. We must all collaborate. We must support all of the different actors, because to create community is what can protect us in front of the risk of suicide. So, before I bid adieu, on behalf and in memory of my son, Jose Ignacio, I thank PAHO for allowing us who have had this experience to talk about this with our voice, because we want to be a part of how suicide is approached. Thank you.
Gracias, Paulina, por
Thank you, Paulina, for your shared words, and especially thank you for sharing your personal experience. And I would like to thank all of the panelists. And now, once again, Renato. Thank you, Deborah.
Many of the Commission's recommendations, we will hear from 2 countries in the region on how they are advancing mental health and their view on the Commission's recommendations. Our first presenter, the Honorable Dr. Frank Anthony, Minister of Health of Guyana. Dr. Anthony has recorded his remarks, which we will now play.
Guyana joins other countries in congratulating Her Excellency Epsi Campbell-Barr, Chair of the High-Level Commission on Mental Health and former Vice President of Costa Rica, and Ambassador Nistor Mendez, Assistant Secretary General of the Organization of American States, along with other members of the High-Level Commission on Mental Health. The Commission has spent the past year analyzing effects of COVID-19 pandemic, including innovative good practice solutions. They have identified priority areas in mental health for the Americas and develop appropriate recommendations to guide policymakers in countries throughout the region. Our nation is grateful for the Commission's effort since its establishment in May 2022. We are pleased to have participated in the interview process that led to developing the 10 recommendations that served as the foundation for the Commission's final report. The COVID-19 pandemic has had a negative impact on mental health of many people in Guyana, as it has in other countries. Even before the pandemic, Guyana had inadequate mental health structures, obstacles to assessing quality mental health services, and insufficient funding contributing to poor overall health in the country. To tackle this issue, the Guyanese government has prioritized mental health and is working to address growing mental health challenges faced by the population. It is clear that there have been significant actions taken to prioritize mental health in the National Health Sector Plan. These actions include giving mental health a higher priority, adding it to the essential healthcare packages, allocating more funding to mental health services, strengthening the governance structure, reviewing and updating the mental health laws in line with human rights, and developing a process for community-based mental health services for people of all ages. The COVID-19 pandemic has generated many discussions around mental health. These have shed light on the seriousness of the crisis and the inadequacies of our mental health services. In response, this commission has provided a studied approach to tackle this problem with a strong commitment to taking prompt action. The Government of Guyana thanks the High-Level Commission for creating a new agenda for mental health in the Americas. This package of policies and actions focuses on universal health coverage, human rights, equity, and non-discrimination. It also empowers individuals with mental health conditions and their families and promotes the advantages of multisectoral collaboration with different sectors and actors can share financial resources, knowledge, and skills. Guyana supports all 10 recommendations outlined in the report. It is committed to collaborating with other nations in the Americas to address mental health challenges and enhance the overall mental health well-being of the peoples of the region. Guyana remains dedicated to supporting the Commission's efforts as countries work towards reducing non-communicable diseases mortality rates by 1/3 and by promoting mental wellness in the Americas and globally. I am grateful to Dr. Barbosa and the team at the PAHO WHO for inviting Guyana to participate in this event. Additionally, I would like to congratulate the Commission on the successful presentation of this report. Guyana.
We would like to thank the Honorable Dr. Anthony for his participation. Guyana has taken noteworthy steps recently to update its mental health legislation and advance suicide prevention. Our final presentation will be delivered by Dr. Delia de Icaza, representing His Excellency Dr. Luis Francisco Sucre Mejia, Minister of Health of Panama. Dr. Delia, por favor.
Thank you. Good afternoon to each one of you. It's a great honor and pleasure to be here today on behalf of Dr. Luis Francisco Sucre, Minister of Health of Panama, to talk a little bit about Panama's experience putting the recommendations of the High-Level Commission on Mental Health and COVID-19 to work on our country. Buenas tardes a todos.
Good afternoon, ladies and gentlemen. Special greetings to Dr. Barbosa, Dr. Rivera, Dr. Epsi Campbell, Dr. Etienne. It is for us an enormous honor, and we're very thankful to be here to discuss the experience of Panama as we implemented the recommendations that today officially are going to be launched as part of the High-Level Commission on Mental Health and COVID-19's report. So there's no doubt that in Panama, just as in the rest of the countries of the region, the impact of the COVID-19 pandemic left a series of scenarios, especially in the realm of mental health, that I think highlighted the discussions on the systemic deficiencies and gaps that we found in the mental health services arena. I think one of the most important points, especially in the post-pandemic context, can be summarized in 4 specific areas that at that time we should adapt to the new normal, the mental health services. These were seen as new alternatives so that we could respond to the needs that arose during the emergency. The increase as a result of the emergency created by the pandemic, there was an increase in the prevalence of mental health disorders, especially those that we most frequently hear about. In other words, as a result of the impact of the pandemic, you have post-traumatic stress syndrome, you have anxieties, depression, and there just weren't enough specialized human resources and a scarce budget allocated for mental health services. So in the face of this perspective, during a post-critical phase of the pandemic that coincides with the creation of this commission, we find ourselves at a very timely and also crucial moment with regards to mental health services. Today, we know, working with Dr. Epsi Campbell, we have her summary of the recommendations from the high-level commission, and this, I think, fills us to a certain extent with optimism because we know we're going down the right path in order to be able to address the crisis generated by the COVID-19 pandemic in the short, medium term, but also in order to establish these foundations that are so necessary and solid in terms of providing mental health services in the long run. One clear example of this is the legislation 364, known as the new mental health legislation in Panama, that was recently passed. This is legislation that goes hand in hand with a strategic government plan in Panama, as well as national policies, healthcare policies. All of that has become consolidated since 2019, since its beginnings when we began to see closer cooperation, where we worked in ensuring public policies that benefit the mental health and well-being of the community. These efforts were crowned on February 6, 2023, when the new legislation was passed that develops and links mental health as a human right and ensures its national coverage. It's a legislation that is currently undergoing some regulatory adjustments and addresses such areas as access to quality services for mental health and encompasses more critical issues that are much more difficult to address, including discrimination against people with mental health disorders, especially in mental health and health facilities and those centers that provide, and also private health insurance. In addition to this new mental health legislation, legislation 364, we can also discuss the legislation 174 that was passed in 2020, which has allowed for making progress in areas involving providing assistance in healthcare, preventing mental health and suicide patterns, looking at the risks of suicide. This commission has been actively engaged, working tirelessly in implementing strategies that help at every level and to promote mental health, as well as focus on preventing suicide risks, as well as timely detection and support for those people who are at risk of this type of behavior, in addition to family members and others who are affected. In addition to that, we have been working to craft an epidemiological surveillance system to address suicide patterns, which is part of the mandatory notification process of informing and reporting suicide patterns, reporting in a timely way to be able to compile data as well, which is essential in terms of evidence-based processes and policies. And also we can also address the fact that Panama has, for several years now, acknowledging gender-based violence as another public health challenge. Now, for example, there is a mandatory requirement for notification of any case, and we have now a form entitled the suspected family violence or violence against the personal safety of individuals, as well as sexual and gender violence. This form is an instrument not only aimed at providing notification on suspected gender violence and domestic violence, but covering other areas. At the regional and local level, we also have had several measures developed aimed at violence prevention and comprehensive support services for those victims and survivors of violence. Ministry of Health is now constantly working with agreements signed, as well as partnerships with other ministries, including the Ministry of Women, that the committee is now focused on enforcing measures to prevent violence against women and gender violence. We also have an observatory working with the Ombudsman, and we also work in accordance with other agreements and working with the judicial branch of government. We've also seen several rules, procedures, protocols, guidelines where we're working to maintain and update and provide all of the necessary information to ensure that we comply with the requirements for providing and addressing the needs of victims of violence, as well as those responsible for acts of violence, and also create solidarity, cooperation, and work, especially in those areas dealing with the new masculinity, which is so important as a factor in domestic violence. And one of the areas, perhaps most important, that we're very satisfied to report and that we've been successful in progressing has been with the incorporation of mental health in disaster mitigation and management, risk management. And frequently we've reiterated that in the midst of a crisis, you see many positive things come about, and to be able to raise an awareness that mental health management practices included in disaster risk management has an importance and a relevance, and it's been made visible explicitly during the pandemic, and therefore this has now being taken much more seriously. So within the Office of Risk Management for Natural Disasters and Healthcare Disasters, now mental health and coordination of mental health efforts is now incorporated in that list, in addition to other efforts and measures that were undertaken throughout the response to the pandemic. We're also focused on creating a technical working group in mental health and psychosocial support efforts. We've also discussed some of our experiences, but it's also valid and necessary to be made familiar with some of the key challenges that the country is faced with just around the corner, because there's so many challenges that we need to take into consideration in this journey toward improvements in mental health services. We are very aware that it's a step-by-step process and that we need to prioritize and we need to upscale step by step. We need to identify specifically these three key challenges that perhaps constitute the most critical challenges, complex challenges, but we've addressed this in a very positive spirit. These are the key immediate challenges. We need to continue to implement mental health measures at the national and supranational level, as already stated by the high-level Commission on Mental Health. We need to ensure that new mental health legislation and other mental health measures be implemented at a cross-cutting level. We also need to improve the oversight monitoring measures, as well as evaluation and research areas in mental health. We need to reinforce the suicide surveillance program that we have developed. And as I said earlier, we need to enable and provide all of that information that will help to guide our future decision-making based on evidence. And one of the key points, probably one of the greatest priorities that we have in common with other countries, in the region is the allocation of budget resources, and the percentage of the budget allocations need to be proportionate to the priorities in the area of mental health services. Only 3% of the budget resources are now allocated, and half of that goes to hospital care, leaving a significant area of mental health services, includes community services, vulnerable and underfunded. This has become one of our key priorities and immediate challenges. So thank you very much for your attention.
Thank you very much, Dr. De Casa. These are really great initiatives and clear examples at the country level on how to advance mental health in the Americas. We will now close today's event. Thank you to all of you who participated in the launch of a new agenda for mental health, the report of the PAHO High-Level Commission on Mental Health and COVID-19. A special thank you to Dr. Jarbas Barbosa, PAHO Director, to the members of the Commission, and especially Her Excellency, Madam Epsi Campbell-Barr, and Mr. Ambassador Nistor Mendez, its chair and co-chair, to Ms. Deborah Castro, Director of the Department of Mental Health and Substance Use at the World Health Organization, and to all our panelists, commissioners, and esteemed guests. This publication, the result of over a year of consultations and discussions, is an invaluable tool for our region as we work to improve and advance mental health following the COVID-19 pandemic. It's essential that as we continue to recover from the pandemic and its impacts on mental health, we maintain strong solidarity and determination, which we as a region exhibited throughout the pandemic. Together we can build better mental health for all. Thank you, all of you, for your participation and for being with us here today, and I wish you a very nice day. Thank you. Ask you to join us for refreshments that PAHO is